Hello, my viewers. When it comes to STI or sexually transmitted infection, early detection saves lives, and most people ignore small signals. Yes, most people ignore those small signals until it is too late. Let's talk about the early signs. Early warning signs your body gives and why you should never ignore them. Number one, unusual genital discharge. If you notice unusual fluid or discharge, pay attention. In men, it may appear a thick, cloudy or yellow drops up from the penis. In women, it could be foul-smelling, greenish or milky vaginal discharge. These signs often point to gonorrhea, chlamydia, or trichomoniasis. You should not and don't wait. Always early testing prevents long-term damage and infertility. Number two, if you happen to have burning or pain when urinating, when you're going for a short call, the pain while urinating means inflammation or infection in your urinary tract. And this is a common early symptom of chlamydia and gonorrhea. If you feel a sharp burn or itchy, something is wrong. Bacteria or viruses are irritating the sensitive tissues around your genital area. Always get medical help where antibiotics or antivirus drug can stop it in early stages before the situations worsen. Number three, if you happen to have a sore, blister, or ulcers on your genitals, I mean open wounds or painful blisters around your private part, these are red flags. These are red alerts. They could signal herpes zoster, syphilis, or gonorrhea. This infection enter through tiny skin breaks during air contact. And when I say contact, I mean skin contact. Herpes soles are painful and recurrent, while syphilis soles are painless but deadly if ignored. Just take note of the difference between the two. Always get a professional test early because treatment protects your partner and your health too. And sign number four, if you happen to have an itching, redness or rash around your genitals, persistent itching or rash in the private area is a classic STI sign. It could result from public lice, trichomoniasis, or yeast infection. And if the itching doesn't go away after basic hygiene or creams, always seek medical attention. See a doctor. Some infections live deep in the tissues, not on the surface. Never scratch or self-treat for long. You might worsen the infection or cause it to spread further. And sign number five, pain during sex, pain during intercourse, or when you're ejaculating. When you reach for maximum or climax and you happen to have that pain, if sex suddenly becomes painful or uncomfortable, your body is alerting you. In men, most of the cases it can indicate urethral infection or a prostate inflammation. In our Eves or women, it may point to pelvic inflammation disease, PID. And all these are caused by infections, untreated STIs. Pain is not normal. It is a biological alarm. Get examined early before scar tissues form and damages fertility for both men and women. Sign number 6, abnormal vaginal bleeding. For women, bleeding between periods or after intercourse can mean infection. Bleeding after intercourse is not normal. Chlamydia and gonorrhea irritate the cervix and the uterus, causing fragile tissues to bleed. And if bleeding is new, frequent, or heavy, don't ignore it. Your reproductive organs might be inflamed or infected. Quick diagnosis ensures full recovery and protect future pregnancies. Number 7, if you happen to have a swelling or a pain in the groin, that swelling in your groin lymph nodes is an early immune response. Your body is fighting an infection, often a viral or bacterial STI. You may feel small lumps, tenderness, or heaviness in the groin. In some cases, it may accompany fever, high temperatures, body fatigue, or general weakness, general body malaise. This sign means your immune system is active and is fighting something unseen. Go for a test, see your doctor immediately. If you happen, number 8, to have a lower abdominal or pelvic pain, persistent lower belly pain is a serious infection sign. For women, it may mean PID, pelvic inflammatory disease, caused by untreated STIs. This condition damages the fallopian tubes and uterus, leading to infertility. And for men, pelvic pain may mean prostate or testicular infection. That pain that lasts more than 2 days deserves immediate medical attention. Fever, body aches, and fatigue is another sign. When STIs spread beyond the local area, your whole body sends signals, react. You may feel feverish, tired, and experience joint pain and aches. This is the stage when infection like HIV or syphilis start to affect the immunity and your immune system overall. Never ignore systemic symptoms after a risk contact. Your body is fighting. Help it with early treatment and rest. Always remember, unexplained skin changes or sore in the mouth. Unexplained skin changes or sore in the mouth. Some STIs show up outside the genitals. You might see mouth ulcers, rashes on your palm or body patches. These are late sign of syphilis or HIV, meaning the infection is already spreading, already in the blood system. Early blood testing can detect them before serious damages can happen. Always remember, your skin and mouth tell your health story. Never overlook them. Never always look down upon these signs. STIs don't always shout. They whisper first. Your body gives early clues, but silent can be dangerous. Get tested if you suspect exposure, even with no symptoms. Anytime you have an exposure and you suspect, even with no symptoms, go get tested. Use protection always. Maintain hygiene and avoid risk or risky partners. Your health, your safety, your future. Protect them all, because prevention is not fear. It is always wisdom, a wise move. So thank you for watching. If this video has really taught you something, give it a thumb up, like, share, and don't forget to subscribe to KhimHealth channel.